Welcome back to The Explainer. Today, we're diving into some frankly fascinating research that literally demands a total paradigm shift in how we approach ENT care. Now, if you work in or study ear, nose, and throat medicine, you know that for decades, we've kind of looked at the ear as this highly intricate mechanical machine. A series of tubes, drums, and fluid chambers. If it's blocked, we unblock it. If it's open, we close it. But what we're going to explore today is this massive shift from a strictly mechanical perspective to a much more holistic approach, one that actually acknowledges the profound emotional reality of our patients. Listen to this for a second. Please, can somebody help me? 1.5 years ago, I was diagnosed with ETD. People sounded like robots. Man, you can literally hear the desperation bleeding through those words, right? It perfectly sets up the emotional stakes of what we're really dealing with here. Chronic ear conditions are so often completely invisible to everyone except the person suffering from them. To the outside world, this patient looks totally fine, but inside, their entire reality, how they hear their loved ones, how they perceive their own voice, how they even exist in physical space, it's all been completely distorted.
Okay, let's dive right into this. We're going to break this down into 5 quick parts. First, the mechanical perspective. Second, the hidden toll. Third, the vicious cycle. Fourth, surgery versus support. And finally, holistic care.
Starting off with Section 1, the mechanical perspective, or traditional ENT care. Now, as specialists, we're incredibly comfortable in this physical space, right? We know the eustachian tube connects the middle ear to the back of the throat. In a healthy system, this tube is normally closed. It briefly pops open when we swallow or yawn, equalizing the air pressure on both sides of the eardrum and letting normal mucus drain out. Honestly, it's this brilliant, elegant little pressure valve. But when that mechanical valve fails, the entire system is thrown into absolute chaos. And that mechanical failure leads to some very specific, often maddening symptoms. Sometimes the tube gets obstructed, maybe from cold, inflammation, or even severe wax buildup, creating an occlusion effect. When that happens, patients feel intense pressure, muffled hearing, and tinnitus. But on the flip side, in a condition called patulous eustachian tube dysfunction, the valve actually stays abnormally open. This causes severe autophony, where a patient hears their own breathing, their own voice, even their heartbeat vibrating loudly right against their eardrum. Patients often describe it as feeling like they have a bucket stuck over their head. As clinicians, we're trained to hunt for these physical causes and fix them. Which brings us to Section 2, the hidden toll, focusing on the psychological impact. Check out these numbers from clinical assessments of patients with Meniere's disease, which, as we know, is a chronic inner ear disorder causing severe vertigo and hearing loss. A staggering 63% of these patients showed significant psychopathology. We're talking clinical anxiety and depression, compared to just 37% with a normal psychological profile. That is a massive chunk of the people sitting in our waiting rooms right now. They aren't just suffering from vertigo or tinnitus. They are dealing with profound emotional distress. And we are just talking about a little mild stress here. Research actually indicates that vestibular and middle ear disorders carry a uniquely high burden of PTSD, intense health anxiety, and even deep feelings of guilt. You might wonder, why? Well, because these attacks, like a sudden drop attack of vertigo or a roaring spike in tinnitus, they're completely unpredictable. They can happen at work, while driving, or right in the middle of dinner. And because the disease is invisible, patients often feel judged by others for their sudden panic or lack of energy. So they end up living in this constant traumatized state of high alert, just waiting for the other shoe to drop. So moving into Section 3, the vicious cycle, where the mind and body basically collide. And this brilliantly illustrates exactly how this plays out in real time. Step 1, the patient experiences a somatic symptom, maybe just a slight feeling of fullness in the ear. Step 2, because of their past trauma, this immediately triggers severe anxiety. Step 3, that anxiety fires up the autonomic nervous system, dumping a flood of stress hormones into the body. And Step 4, those hormones cause muscle tension, rapid breathing, and a hyper-awareness of sensory input, which literally worsens the physical symptoms. The loop just feeds itself. The literature really hits the nail on the head here. It says, the resultant anxiety provokes various symptoms, probably through disorders of the autonomic nervous system. If a patient's nervous system is locked in a fight-or-flight trauma response, their physical symptoms are just going to continue to cascade. I mean, think about it. Muscle tension in the jaw and neck can easily worsen conditions like tensor-tympani syndrome, where the ear muscle starts painfully spasming. The mind and the ear become hopelessly locked in this cycle of mutual destruction. All right, Section 4, surgery versus psychological support. It's time to reevaluate our toolkit. On the mechanical side, we've got these incredible modern interventions, right, like balloon eustachian tuboplasty. This is a highly successful, minimally invasive procedure. While the patient is under anesthesia, we insert a specialized balloon catheter into the eustachian tube and inflate it to 10 bar of pressure for exactly 2 minutes. It physically reshapes the tube opening, functionally restoring pressure regulation in the ear. The whole thing takes about 20 minutes and boasts success rates of over 80%. It is a phenomenal mechanical fix. But here is the critical catch. While a balloon tuboplasty is amazing for restoring physical pressure, a mechanical balloon is not going to instantly cure a deeply entrenched fear of the next vertigo attack. It doesn't just erase the trauma of having lived with unpredictable hearing loss for years. We absolutely need psychological support, like cognitive behavioral therapy, to reduce that fear of flare-ups, to build coping mechanisms, and to actually address the underlying PTSD that keeps their nervous system on such high alert. Which leads us perfectly into our final section, Part 5, a holistic treatment model where we synthesize both of these approaches. So what does this actually look like in daily practice? It's all about multi-team treatments. It means the ENT physician steps up as a coordinator of care. Sure, we fix the mechanical blockages where we can, but we simultaneously partner with audiologists. For instance, using tinnitus retraining therapy, or TRT, which uses controlled sound amplification to normalize sounds and desensitize symptoms. It also means actively prescribing stress reduction and mindfulness techniques to help the patient safely coexist with temporary discomfort. We are fundamentally changing how the patient's brain reacts to a flare-up. So the crucial point here is this: integrating mental health actually reduces the perception of pain and significantly improves treatment adherence. Holistic support isn't just about making our patients feel, nicer. It's a clinical necessity. When we calm that autonomic nervous system, our physical medical treatments literally work better. Patients are way more likely to stick to lifestyle modifications and vestibular rehab exercises when they aren't completely paralyzed by health anxiety. I want to leave you with a question to chew on today. Are we just treating the ear, or are we treating the patient? When someone comes in complaining of fullness and pressure, yes, we absolutely must look at their tympanic membrane. But we also have to look at the human being sitting right there on the exam table, who might just be living in a state of invisible terror. By integrating psychological support with our incredible surgical advances, we can finally silence that invisible echo for good. Thank you so much for joining me on this deep dive. I really hope you found this as fascinating as I did. Catch you next time.